The Wellness Hour. An in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You are watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, mommy makeovers. With us, we have the most popular, the hottest plastic surgeon in Beverly Hills, Dr. Rady Rahban. Dr. Rahban, welcome to the program.
Good morning. How are you, Randy?
Now, this mommy makeovers, I mean, it really is, you say, a hot topic. More and more people are coming in for this.
Yeah, I think definitely. I think as people are becoming more educated with the concepts of plastic surgery, it's becoming increasingly common, women coming in for their breasts, their abdomen, liposuction, things of that nature.
Is that what defines, by the way, in your mind, the mommy makeover is what, breast?
I think mommy makeover, it's kind of a catch-all term. And essentially the three main areas is breast augmentation, breast lift, breast manipulation. There's abdominal surgery in the sense that there's tummy tucks, and finally there's liposuction.
So you do it all at once?
You can do it all at once. Depends on the patient, but in general, that collective three is the most common procedure. And then there's ancillary services and things that we do in addition. But I would say that's the core three procedures that kind of comprise what a mommy makeover is about.
Now, before we get into today's topic, tell me about your practice. What kind of patients are you seeing?
My practice it's pretty amazing, I got to tell you. I'm very proud of the way my practice is developed. I have a spectrum of patients. I take care of young patients from the age of 19, 20-year-olds all the way to patients that are in their 70s. I take care of people that are CEOs, people who run their own businesses. I take care of housekeepers. It's pretty broad.
So you do facelifts, you do,
I do the gamut. I mean, honestly, okay. I do the gamut. I truly love plastic surgery because of its breadth. So I have never really, there's not one thing that I love so much that I want to spend the rest of my life doing. I love facelifts. I do breasts, I do body contouring, I do rhinoplasty is one of my favorite procedures to do. Honestly, I do body lifts now, which is very common. A lot of people losing a lot of weight loss after gastric bypass surgery is one of the more challenging procedures to do.
Okay, now let's talk about your background and training. You're board certified.
I am.
Plastic surgeon. And where'd you go to medical school?
I'm a Southern Cali guy. I did my undergrad at UCLA in LA, and then I went down to San Diego, and I did my medical school training in San Diego. And following that, I went up very far to USC, and I completed my training there. So I did general surgery and plastic surgery at USC. So I've spent all my life here in Southern California.
You're an artist as well.
I am.
Right?
I am. I love
Tell
art.
me about that. And photographer.
Photographer, artist. It's funny because when I was thinking of going into plastic surgery, at the beginning I wanted to be an architect. And architecture was a real passion of mine when I was a young boy. And as I started to kind of get into the sciences and dabble, I started to be like, wow, there's a lot to be said for science. And then one day it clicked, and I was like, science, art, and it's just nothing better than plastic surgery. So,
do you consider yourself an artist? I mean, when you're with a patient, do you see the end result in mind when you're
absolutely
doing a
There's no question about it. I think that in order to be an excellent plastic surgeon, you definitely have to have an artistic eye.
Your practice, I've seen it online, looks good.
Thank you. Actually,
you're a decorator?
I'm a decorator. I'm very proud of my practice. We recently built a...
So you decorated it?
I built a beautiful office from scratch. I did all the decorating myself. I did all the space planning myself. I had a little dabbling in architecture, which is what I love. I picked all the staff. All the photography on the wall is mine. All the paintings on the wall are mine. And I made sure, I wanted it to be a place where I could spend the next 20, 30 years and just grow a practice. So I have everybody in sort of the particular places where they need to be. My staff and my office manager. So it's really.
And you speak Spanish?
Fluent.
Do you get a lot of Spanish?
I do. I get a gamut of patients, and I get a lot of Spanish-speaking patients. I have a real warm place in my heart for Latino community, and I did a lot of. When I was in San Diego, I was close to the border, and we would go across and do volunteering. And even in my training at USC, there was a lot of Latino patients. So as time went on, my Spanish got better, and they're just a great community.
So you're fluent.
Fluent.
So you speak Spanish on some of your consults?
So puedo hablar completamente en español.
All right. Now your volunteer work. Tell me about that.
It's great. I go to Guatemala every year, and when I go down there with a group of doctors from Cedars-Sinai, where I'm on staff at the hospital, and we go out to rural areas in Guatemala. It's like MASH. We set up a hospital out of nowhere.
Is that right? Okay.
We bring everything ourselves. We pay our own ways, and then when we get there, they know we're coming. So there's a huge outpouring of patients from all over Guatemala that come. And
a lot of cleft lip and palates.
Cleft lips, palates, burns, hand, congenital deformities, tumors, things like that.
So you do reconstruction. I mean, even in your own practice.
I do. I do the gamut of plastic surgery. I got to tell you, when I was choosing a profession and I knew that I wanted to do art and science, I knew that I wanted to do plastic surgery. And
really?
the thing about plastic surgery that's different than, say, cardiac surgeons or colorectal surgeons, we can do anything. If you're skilled and you have the art and the eye and you connect with the patients, you can do everything. And so my training was very, very extensive. And when I got out of training, I just couldn't bring myself to let go of any particular area. You know, I love the gamut of plastic surgery. So I do reconstructive surgery, I do breast cancer, and I think that allows me to be an excellent cosmetic surgeon, and the cosmetic surgery allows me to go for the finest details and reconstruct. They all play off each other. I mean,
you say you're changing people's lives. How so? I mean, with what you're doing, and we'll move into mommy makeovers in a moment.
Sure. I mean,
you see changes in personality?
Absolutely. There's no question about it. My patients come back, and one of the things that, you know, medicine in the art form, it's great. Surgery is awesome. I love to operate. I mean, when I'm in there, I'm in a zone. But one step higher than the surgery is the people. I mean, it's a people's profession. You interact with the patients, you talk to them, they connect with you, you go to their children's birthdays. I take care of kids, I go to their birthdays, and we connect with them, and then you know for a fact that you're changing lives because they tell you. You go to their parties and they invite you to things, they send you Christmas cards, and when somebody has a surgery, if it's cosmetic, they change their charisma, they change their energy, they're feeling sexy, they want to go out and conquer the world, whether be reconstructive, then they are more functional, they have better form. So I know for a fact that at least when I am done with my profession, that I will have made a huge impact in many people's lives.
Good. Now, the demographic with the mommy makeover, who is it? I mean, are these working people? Are they housewives?
You know, the demographic
are they single?
it's pretty broad. The truth is today in the workforce, you know, people are no longer kind of categorized. I mean, we have women that are 25 years old and have 3 children and they're ready to, you know, get back into, you know, workforce. We have women that are 45 that are, you know, finished having their children. So I'd say that it's a real broad spectrum. I would say anywhere in women in their late 20s, all the way up until, you know, even their 50s. Because
so in a recession, people are doing this.
You'll be surprised. You know, there's definitely one thing for sure during a recession. You invest in your home and it's going down in value. You invest in stocks, it drops in value. Yeah. One thing that will always be is if you invest in yourself, you'll always get reward from that.
Do you find people doing that then?
They are more and more now because of the recession. If people have found that they got to depend on themselves to bring in that revenue and be productive.
Well, good. Okay, so you brought some photos. What are we going to look at here?
Well, what I'm going to tell you, this is the first patient of mine, and what I'm going to tell you about this patient is I categorize mommy makeovers into certain categories. In terms of breasts have several forms. After you have a baby, the natural progression of your body is to go as follows. You had perky breasts with volume. You breastfeed and you have several children, and what happens is you lose volume and your breasts descend or they sag, okay? So we deal with that commonly. And so when patients come in, and this patient particularly is a perfect example of that, she lost all the volume and her breast descended. And when you're dealing with volume, we're talking implants. When you're talking about sagging, there's 2 categories.
All right, so in this one, is this a lift? Is it a...
So this patient, when she came in saying, I want to have a fuller breast. She's working out like crazy and she lost volume, right? And when you look at it, you're like, she may need a lift. But in this instance, with the right selection of the implant, she was able to get enough volume and fill out her breast. And this lady was ecstatic. And, you know, she'd been working out because she wanted her 6-pack back, and she lost even more volume. And with the help of an implant, she has a beautiful kind of a natural breast to her. So what was incredible about this patient, what she said to me that resonated in my mind was, you know, what drove her to come have it done wasn't so much that she wanted to have big breasts. She wanted to be able to wear a bathing suit. And as a guy, you know, people don't appreciate that as much, but that's essential to a woman's existence, is wanting to wear...
Want to have the cleavage again.
Cleavage, have, you know, feel sexy in lingerie, wear a bathing suit, and I think that's very much the same.
Is there a lot of technique to breast augmentation and lifts? Because it seems, you know, that everybody's doing
that. Well, okay, that's a great point. This is it. Can you build any house? Anyone can build a house, but then can you build a magnificent house? And there's a lot of people doing plastic surgery today. The question you have to ask yourself is, do you want just any house, or do you want a beautiful home? And a house is not the same as a home. And I would tell you that although people have a kind of not the really good understanding of it, but breast surgery, breast augmentations, and even more so breast lifts require finesse. That's why you can have 2 breasts, or you can have two breasts that are like this, or you can have 2 beautiful breasts. And behind clothing, everyone calls them breasts. But in intimacy, when you're with your partner or by yourself, you wish your breasts were symmetrical, the same size.
A lot of technique involved.
Absolutely. There's no question about it.
Okay. Now the next patient. What are we looking at?
So the next patient that I have here is another young lady who came in, and she too was a patient who had lost volume in her breast. She had breastfed 2 children and wanted her breast back. She complained specifically that when she was with her husband, she didn't feel sexy anymore.
Okay.
And so with the help of the augmentation, giving her a great result, and she wanted to be natural. That's something that I hear all the time.
They want to be natural.
Natural, of course. And one of the things that I try and do is guide my patients, because some patients know what they want, but then some patients need a little guidance. And I spend maybe an hour and a half in each of my consultations, which is a lot of time. Because for me, all that matters is that you're happy. And if I do what I want and you're not happy and it looks beautiful and we weren't successful. So we spent a lot of time with her to get her a natural look. And I think that...
Now I'm looking at the version that, you know, and we're going to put these full screen when we air this, but I don't see the incisions. Where are you placing your incisions?
Predominantly what...
I mean, this is nice work, I guess, because you can't see the incision.
Okay, right. So the incisions are, you know, they can be in different places. Generally speaking, I do probably the large majority of my incisions around the areola, at the junction of the pigment to the skin. And the reason is that you want to hide it. You want there not to be visible. Some women who have large enough areolas, we can do that. In patients, maybe Asian patients who have very, very small areolas, we put it in the crease. And they heal incredibly well. In the fold of the breast, exactly. And you know what people...
What about a doctor that tells me, Randy, the problem with going in through the nipple area is, you know, if the nipple is the most beautiful part of the breast, I don't want to touch it. I want to go in the fold. What's your response to that? You think they're just not good at?
No, I mean I think that's a cop out. The fact is that you look at most of the playmates on TV and in magazines, and I would tell you the large majority of them have their incisions through the areola, around the nipple. So
is it more technically
demanding? Of course, absolutely. Well, of course, I take an extra half an hour to close. It's easy to close from the bottom. You just close it and nobody knows. But if you want to close through the areola, you got to take time because you have to close every layer. Otherwise, it dimples in. So yes.
So now these are mommy makeovers, but it's just breasts. You have some lipo and tummy tucks.
Absolutely, of course. Here's a lady that was 47 years old, right? She's 47. Of course, she still wants to look beautiful. And here's a perfect example of a woman who underwent a breast augmentation for deflation and descent of her breast because she had children earlier, you know, with a beautifully natural result. And I think
very nice.
And you know,
and the incisions are around.
And these are around the areola as well. And if you look, you would be hard.
We won't be able to show that on TV, but I'm looking right at it.
You would be hard pressed to be able to find that scar.
Okay. What is the same patient right there?
This one here is now a different category of patients. So same idea, had children, nursed, maybe even didn't nurse, lost volume and descent. And this patient, if you can see here, has had a lot of descent, a lot of sagging.
So this is a breast lift.
You got it. So this one is a breast lift with an augmentation. So the augmentation gives her the volume, and the lift makes the shape of the breast beautiful again, without it looking kind of saggy and the nipples pointing downwards. And with this technique...
So very small incisions, by the way,
the incision, you know, the incisions go around the areola and come down, and essentially in most instances I've eliminated the scar across, but some people need it. For me, because my scars heal so well, I always talk to patients, I said the most important thing is beautiful shape. My scars heal beautifully, so I'm not concerned about it. I'd rather them get a beautiful shape and have a few scars.
Define a beautiful shape. What?
For me, a beautiful shape is one that is round, one that has cleavage.
Round at the bottom?
Round, just circular and round, that has cleavage in the midline, you know, around where the cleavage comes together. A little shape around the armpit. It's hard to describe. It's one of those things that if I pointed...
So that's in your hands, though, as a surgeon?
Absolutely, 100%.
Because it seems straightforward, respectfully, that you know, you're putting in implants and you just see what happens. But there's a lot to it.
There's a lot to it. Okay. There's a lot to it, and there's a lot of artistry because we do this little by little.
So she must be thrilled, obviously.
She was ecstatic. And if you look at the pictures, it's going to speak for itself because she went from being deflated and down, and now she's got round and breasts with a lot of volume. So in clothing, it's hard to tell. And you know, that's why a lot of these patients, nobody knows because they're keeping it to themselves. But when she's out of her clothing, when she's looking at herself in the mirror, she looks dynamite. She now looks symmetrical, so she looks thinner. She looks fitter.
Yeah, she looks very fit in the after.
She does, right? She looks like like she's gone to some boot camp or something. But the reality is, it's the balance. It's the harmony of the breast in relationship to a very slender.
Are there a lot of people that are, a lot of women, you know, knowing that you were coming on the show, I'm talking to them. A lot of women are afraid of the breast lift because they think it's such a major surgery. It's going to leave them very scarred.
Absolutely.
Is that something not to worry about?
It's a very, very common misconception. And it's funny, when patients come to see me and we have the discussion and then I'm show them photos, like, God, I wish I'd come in sooner. The reality is, yeah, there are scars. If your breasts have come down a lot, you can't get away without scars. If you go to a doctor who puts a big implant in because you didn't want the scars, you'll ultimately be disappointed.
But it's going to look better.
It's going to look fantastic. And with the scars, if you take time to close them, they're not an issue. They fade with time. They become negligible.
All right.
And that's the key component. But the thing is, you got to take time. You just can't stitch them together. You got to put in that time.
And when you say that, it implies that that's going on. out there.
It implies that that's.
You see a lot of bad work,
I do.
by the way?
I do. I see a lot of bad work.
That you go, oh my goodness, I can't
well,
believe
you know,
it.
but patients are not, you know, sometimes they don't know any better. They go to people that aren't board certified. They go to people that aren't even plastic surgeons.
Or they don't have an eye for it, I guess. Because I've met non-board certified guys that are very, very good.
Right.
I've also seen a lot of breast photos, and these are some of the best I've ever seen.
So yeah, I think people have, ultimately you're right. Someone's got to have an eye for it.
All right, okay, so what else are we looking at? And then we're going to take a quick break.
So here's another example, perfect example. This woman came to me, sweet as can be. She had triplets, 3 children at one time, okay?
Right.
So she had a dramatic change in her body, to say the least, okay? She came in and her abdomen had stretched out. She had all these stretch marks, and I'll show you her pictures later as far as her abdomen. And her breasts had descended and sagged, and she hated it, and she didn't feel sexy. So with her, what we did was we did a lift. We removed the extra skin and tailored it, and just like a seamstress, brought it together and pinched it and did that, and then we put an implant. And I would ask you to take a look at these pictures and tell me where you see the scars.
Yeah, you don't.
Because you know why? Because you have to take your time to do it. If you take your time to do it...
She also was uneven in the before.
Exactly. She was much larger on the right side than she was on the left, and we were able to get that symmetry, that shape.
Is that hard to do?
Very. But it's something that can be done if you take your time. So she was another example, and if you look at the...
So on her, you did a tummy tuck.
I did a tummy tuck. I did liposuction on her sides. And
so
then
that's a mommy makeover.
She was a classic. She deserved it. She earned it. She was a very, very sweet woman.
What do they say when it's all said and done? You know, they go in for a follow-up. Do they tell you stories about how their confidence is better?
Yeah, of course. I mean, they come in and tell me, and you know, I love what I do because of that. I love to see the good work. When I see good work, I get excited because it shows that it worked. It was beautiful. But I get even more excited when people come and tell you, you know, I feel great. I want to thank you for that.
Do they start dressing differently? Sexier?
They buy new clothes. They buy different tops. They buy tighter clothing. They buy, of course, when you do a tummy tuck, they have to change all their abdominal wardrobe, all their pants and their skirts, because their waist size changes. Yeah. So they buy a whole new wardrobe.
We're going to take a quick break. We come back, more of the mommy makeovers. I want to see some of the lipo pictures and the tummy tucks in combination with breath.
Absolutely.
You have those. Okay.
Yeah.
You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. We are here with Beverly Hills plastic surgeon that's getting a lot of attention lately because of the results he's getting with his patients, Dr. Rahban. We'll be right back.
Designs for Health is the nutritional supplement brand of choice, exclusively recommended by healthcare professionals.
As a physician, I insist on the science-first approach of Designs for Health. They have synergistic formulations with optimum quantities of therapeutic nutrients.
Designs for Health, the leader in professional brand nutritional supplements.
Tried all sorts of cover-ups for bad breath? Try the science of BreathRx. Only BreathRx has Zytex. It attacks the cause of bad breath, keeps working for hours. It's clinically proven for real fresh breath.
Get non-prescription BreathRx from your dental hygienist and now at fine stores everywhere.
You're watching an extreme makeover edition of The Wellness Hour. I'm Randy Alvarez. You're watching The Wellness Hour. With us, we have Beverly Hills plastic surgeon, Dr. Rahban. Okay, so mommy makeovers, if they're just tuning in, what are we talking about?
We're talking about a woman who has children, and then after having her children, she recognizes that her body doesn't look the way that she did when she was 20 and 30, and she wants to find her way back to her previous form, her previous beauty, her sex appeal. Okay. And so through different techniques in surgery today, we can improve the shape of their breasts, give them their volume back, make their abdomen slender, get excess skin away, and we do that all together, and collectively that's called a mommy makeover.
Now we're just about out of time. So your tummy tuck patients.
Right. So this is where you make even a more dramatic change because with the abdomen, it's such a huge part of your body when you wear clothes, and it changes so many aspects of your life. So she came in and she was very concerned, okay? And we sat down, we talked, and I described to her. Her problems are as follows. She's got a protuberant abdomen, okay? Means her abdomen is pushing out a lot. Okay. Secondly, she's got a lot of extra tissue on the sides, okay, on her flanks, on her sides here, and then she's got excess tissue, extra skin. And what happens is that the muscles underneath have stretched. And that's what, I'll show you some patients. Even if you're skinny, you still have a belly. And the belly is from the separation of the muscle. And so even if you go to the gym 100 times a day and you kill yourself and you lose all the weight, you'll still have a little pooch. So with this patient, we talked about what her options were, and it was clear to her that she needed a tummy tuck, which essentially is.
And liposuction? And
liposuction on the sides. She didn't need that much liposuction, but she needed a little bit on the sides to get her waistline back, okay? And so what we did was we did a tummy tuck, and with that, we removed a lot of extra tissue from her abdomen.
Unbelievable.
We tightened up her muscles, which she would have never been able to do.
Doesn't look like the same person.
I'm telling you, and she doesn't feel like the same person. And as a matter of fact, this patient is a very close friend of mine now. We've become very close through this experience. And it's very touching. She came to me and she told me at an event we had that she was intimate with somebody for the first time after a year. And she was teary-eyed, and she said, you know, I was able to do that because now I'm able to be naked again.
Okay.
So she's, you know, perfect example of a patient who had a major transformation through these procedures.
Especially in pants. I mean, the side
you look at
shot
this,
is dramatic.
you'll see the side shots, and you just, I mean, look at this. I mean, it's a significant difference.
Amazing.
So let me show you another patient. Here's a patient who, if you look at her, you'll see
a very odd look. How did that happen on the before?
So this is another patient, very classic, had C-sections that had gone awry, had all these scars on her abdomen, and was so ashamed of her abdomen. She's not very heavy set. She's not very fat. From her side view, she doesn't have a lot of protuberance.
It's not a feminine abdomen
at all.
Sure.
You know, this is equivalent of stretch marks. This is, that's a perfect opportunity to talk about that. She has a scar there from a C-section, but it might as well have been stretch marks. And the fact is that even if you're thin, and even if you don't have a big belly, if you have stretch marks or scars like this, you're not going to run around in a bathing suit. It's just you don't feel attractive.
All right.
So with the tummy tuck, if you can see in her follow-up there, that scar that she had is gone, and it's a dramatic change. And
so you cut that skin
we take out.
I mean, how many inches of stretch marks?
You know, it depends.
In theory, could you take?
We could remove. I would say to you, on average, we remove that much. Now, you know, it really depends on the amount of laxity you have, but you remove a significant amount of tissue. So imagine all that stretch marks.
You say you like to put your incisions very low.
I do.
As low as possible.
Well, and in this particular example, you can see I like to put it low because, you know, you don't want to trade off C-section scars and stretch marks for a high-riding scar. You're really not, you know, you're still not going to walk out in a bathing suit. So you want it to be hidden. That's the goal.
Is this common? I mean, this kind of a look because it's dimpling before.
You know,
I don't see it.
You know, the truth is these patients, you don't see them because they're not wearing bathing suits. They're not at the beach. They're not sipping pina coladas at the poolside because they're not feeling sexy.
All right.
So that's why you're not seeing them, okay?
All right.
But I see them in my practice, and unfortunately, you know, it is common, but we can fix it. That's the great part.
Good, good.
So you can see this, and this view will really is a very dramatic view, and I use this view to demonstrate that you can see the difference.
This is that same patient?
Same patient. Speaks for itself.
This is a huge, huge difference. Is that months later?
No, this is only, this is 3 months later.
All that fat is cut out.
Gone.
I mean, just so I understand this correctly. Okay,
Skin and fat. Here's another example. Another woman who had a dramatic change. I use this picture because I want to show patients how much we remove. You can see in the markings in this patient where the top line is the amount of tissue that's moved. And if you look at her from the front at an angle and the money shot that I like to call it, you can see the overhang on her belly is gone.
Mm-hmm. Perfectly flat.
And she's flat. And most of all, one of the things that I do with tummy tucks, I spend a lot of time with tummy tucks. It's not just cutting out the extra stuff. It's contouring the abdomen and putting the belly button so that it looks natural. You know, again, you can build a house or you can make a home. So tummy tuck's a tummy tuck. There's a lot of people doing tummy tucks that are not trained to do it. But it's the little nuances. It's how the scar heals. It's the transition. You know, people have a tummy tuck and they have a little shelf where the abdomen comes together. I thin all that out. In the after photo,
it's all gone.
It's all gone. That's a significant.
Did you do breast and tummy on her?
On this patient, she had her breast done before, and she was actually unhappy with her breast, and she came to me for her tummy.
All right.
Okay?
Looks very good.
So here's an example of a patient that I want to show you that is different than these other patients. This patient isn't heavy set. She's in great shape. And when she wears clothing, you would never know that she had anything that she was ashamed of or didn't like.
So that wrinkly
You take a look at that wrinkly
pregnancy.
skin. It just never snapped back. She had several children.
Like 1 out of 10 women this happens to?
No, I would say it's more. I can't tell you specifically, but I would tell you it's more. I would tell you it's
because that looks like an older abdomen.
Right. But what
she's not older?
She's not that older at all. This lady was about 38.
Yeah, that's young.
And so what happens is I want you to take a look. If you look at her, the most dramatic change in her is not that her abdomen is flat now, but all that wrinkly skin is gone. And so even in kind of attractive underwear or something sexy, she can now feel good about it. And she was in shape and she was fit. And I can guarantee you that in very kind of tight clothing, you would never know.
But she knew.
She knew, of course. So there's a lot of patients that aren't heavy set that are still great candidates for tummy tucks.
Okay, good. We have time for just a couple more.
All right. Well, I'm
good stuff.
This is a patient of the true nature here. She had her breast, her abdomen, and lipo all in one setting. And what's most dramatic about this is just look at the two patients formed before and after, and you can see
huge overhang.
It just the whole shape of the body changes.
just a couple weeks out?
This is 2 months out.
She didn't lose a bunch of weight?
No. She
so
didn't lose
that big belly's just gone. You cut that
We remove it all out. It's
right?
one of those most gratifying procedures because it's instantaneous.
We haven't talked a lot about safety, and we are out of time, but
safety is tantamount. I think safety is probably the most important thing to talk about. You know, we do everything in our power to make sure that we not only pick the right patients, but take them to certified surgery centers. We have our anesthesiologists are magnificent. We check their labs. We do full screening of their health. We don't just, you know, this is talking about the results right now, but there's a lot of work that goes into making sure that patients are good candidates.
Okay, somebody watching this, they're unhappy with their breasts, their abdomen, they've tried to exercise. What can they expect when they go to your office? Who do they see? Take me through the process, the basics, and we have about 2 minutes left.
No problem. So what they'll do is they'll come into our office, and I think the office is designed to be incredibly warm. They come in, we have our office front staff. They'll greet them, they'll bring them in, and after then they'll be brought into the consultation room. I meet every patient myself. I do all the consultations myself, and I spend on average about an hour to an hour and a half with every single patient. It's a lot of time, a lot of information. And I think what I hear back from patients, like, I've never really had anyone spend this much time with me. It's a lot of information. After they're finished talking to me, they meet my office manager, they talk, they try and kind of coordinate what works for them. We work out on financing. We have all types of ways for patients to be able to afford it. I think affordability is a huge concern of patients today.
Okay.
We have lots of methods of payments for patients to make it feasible for them. And then we meet a second time. I see my patients 2 times before surgery.
For mommy makeovers, if they have a significant other, do you like them to bring that
Sure,
person?
of course. I want them there. I want that significant other because that person is part and parcel in their decision making. They're part of their lives. Now, I don't want them there putting things in the mouth or the ears of the patient.
Like pushing it on.
Yeah, of course. I'm very sensitive to that. I recognize when the patient is doing it for their own desire or for somebody else's wishes. But absolutely, I want their spouse there.
So these photos are on your website?
Absolutely. My website has everything you can
nice
imagine.
Website.
Yeah, thank you. It has all my before and after photos. It has my resume on there. It has pictures of my facility. It has all of my work on there. So it's a very informative place for people to go to get a basic idea and get an understanding of what we do.
So it all starts with a consult then? And for these people that are afraid of putting it off?
I would tell people who are afraid and putting it off, the very least they can do is come in, get informed, and know what their options are. Because once you have information, knowledge is power. Then you can make decisions. There's no obligation to anything. You can make any decision you want to make. But without knowing, how can you make any decisions? And because most people don't get things taken care of because of fear. And education will eliminate that fear.
All right. I want to thank you for coming on the show.
Well, thank you for having me. I appreciate it.
Great work, too.
Thank you very much.
You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again, you could go to our website, type in plastic surgery or Dr. Rahban's name. You can see it again or point it to a friend. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.